This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
All of these reports are actually similar to our podcast, publicly available within the Vizient Insights page. And a great place to get started is to read the issues, understand what kinds of data we are triangulating to be able to answer the questions, then assess, do you have that data, because many of you, I'm sure, do, internally available.
Welcome to Sg2 Perspectives. I am your host for today's episode, Jayme Zage. I am joined by my colleagues, Brianna, Motley, and Maji. They have been central to a new publication series that we've been focused on called Data on the Edge. Data on the Edge is an analytic-driven series that brings together the impact of change and claims data that we use, but also cost, quality, and operational performance data. I've brought them on to talk about some of the insights that they've gained over the year from all of the new reports that they've put out. Welcome. We're happy to have you on to share your insights on this exciting new way of pulling data together. Data on the Edge series was launched in 2024. I want to understand from you two why it is so strategically important to go beyond just the utilization data and why we need to pull in these other data assets as well to get a good picture and move strategy forward.
As we took a step back and looked at our strategy for 2024 from a content standpoint, one of the things we realized was we've been publishing a lot anchored on our traditional historic market and utilization data, but we have access through being part of broader Vizient, a lot of other data sources that we can bring to help problem solve from a strategic standpoint. Specifically, clinical data, operational data, performance data, all of that collectively, when you bring it together with ambulatory and utilization data, helps to set a strategic foundation for performance improvement. And that's something that health systems are intently focused on, given the broader environment that they're operating within today. It's not enough to set a strategic plan based on what the 10-year forecast projection is going to be and what historical utilization has looked like, but really understand where do we have opportunities for performance improvement and how is that going to inform our ability to solve capacity problems, our ability to solve access problems. The problems have become more complex. We need to bring full data sources to bear to help solve those problems.
Brianna, you're right on. Another thing that we do when we set the agenda for the whole year, all 10 reports that we published in 2024, we look at topics that are important to our clients of their health systems, topics like ICU, ED, virtual visits, disruptors, ASC, strategy, etc. Those issues being more complex. We cannot just use the strategic lens to look at all these topics without thinking about capacity, the clinical implications, and even operational efficiency. So that is the reason why from the strategic and operational and clinical standpoints, it is great to combine all these and bring out the capability that we have from the data analytics standpoint.
Let's talk about some of those specifics. Brianna, let's start with you. What was one of the most insightful pieces that you can tell our audience about?
The ED is a fascinating place, and it was wonderful to be able to bring not only our historical and utilization projections from an ED standpoint to the market, but to be able to combine those with the operational performance data. One of the questions we get from our members a lot at Sg2 is, can you tell me what my turnaround time should be, what my throughput time, my length of stay time within the ED should be? Help me benchmark that. And that's something we've been unable to provide insight into in the past. But through the ability to bring together all of these different data sources that we have access to at Vizient, including the clinical database and the operational database, we were able to answer those questions and benchmark length of stay by different volume bins, which from a strategic standpoint helps you understand, am I a length of stay outlier as it relates to other EDs that are similarly sized across the country? Because the ED is so dynamic, it is the front door to the hospital. There were tons of other insights that we were able to provide visibility into, including how is payer mix trending across the country? Are we seeing shifts as we look at that from a historical standpoint, for a long time at SG2, we've been talking about urgent visits moving out of the ED becoming higher acuity. We were able to put specific numbers to that by bringing together the breadth of our different data sources. From a design standpoint, our creative team has always been such a good partner in development of these, and they were able to create a performance dashboard that essentially bridges operational performance and strategic forward-looking performance. That's one that I would point to that was a really good representation of the power of bringing all of these different data sources together.
That's great. There's another piece that's about transfers that also impacts the ED. So lots of great content around the emergency department. Catherine, which is your favorite?
My personal favorite is the one about outpatient market share. What is outpatient market share? That question has been a frequently asked question from our hospitals systems members. You think about this question, it is much more complicated than that. If you're thinking about we have been trending and calculating inpatient market shares and managing it for years, outpatient market share is a totally different ballgame. The report is about how do we advance our performance from the outpatient perspective. We took a step back and talk about the organizations, what they need to do to achieve outpatient performance improvement. We all know that in the last decade or two, healthcare organizations have been enjoying the outpatient volume growth. And a lot of time, you don't even need to think about your market share because volume has been growing from E&M all the way to outpatient surgical services. But it is very important still to understand how you can actually outperform your competitors. With all the data and assets that we have, one of the fun things that we did was create a framework to help our members assess your outpatient performance and also how do you improve. So the 3-step is about understanding where your care is delivered. Number 2, how do you break down outpatient market share? You can do a calculation that is more meaningful and then think about all the measures that you can actually compare and contrast and to benchmark your improvement.
What were some of the most surprising insights that you found through bringing all these different data elements together?
One of the fun aspects of this new publication is we go into it with a hypothesis of what we're going to uncover in the data and what we're going to find. For every single issue, there has been something that's come out of pulling the data together that's been surprising. So maybe let's highlight a couple. In July, we published on disruptor impact and looked at disruptor activity, compared it within a couple of different markets. And the surprising insight for that one was the degree to which disruptors have penetrated specific service lines. So think oncology, GI. We were expecting for sure to see disruptor activity as it related to primary care because we know there are access challenges there. There are also access challenges from a specialty standpoint. And the degree of penetration in certain markets was surprising. I would point to in October, we looked at ASC utilization specifically across different markets. We are always talking about the shift to outpatient and how you have to differentiate that between shift to HOPD versus shift to ASC and shift to physician office. But being able to isolate specifically within our share of care data set, that ASC penetration was surprising. We know that it's variable across markets, but seeing the specific numbers associated with individual markets like Chicago was pretty surprising because it is a fair degree lower than what we would have expected to see within the data. And then I have to do a plug for our last issue of the year, which looks at surgical inequity. It pulls together our IOC data, also our Vizient Vulnerability Index. We wanted to make sure to highlight a story on equity for the close to the year and the degree of variance in mortality outcomes, specifically for valve procedures that we see in markets that are more vulnerable versus less vulnerable was one of the surprising outcomes there. Obviously not a positive outcome, but specifically for surgical valve procedure, there's almost a 3% difference in inpatient mortality based on whether you're in a highly vulnerable neighborhood. And that was something that we had to publish on. Lots of different insights and lots of really great stories, which was one of the drivers behind bringing these data sources together.
The value of creating that insight and understanding is now we've got a foundation on which to drive improvement. We didn't have before because we didn't have that insight. Those surprising insights can be very valuable, even if they're discouraging at the onset.
It comes back to you can't address the problem if you don't have visibility into what specifically is driving the problem, which is really the true power in bringing these data sets together and seeing how these topically have resonated with our clients and members has been amazing. I'm not going to steal Catherine's thunder, but we already know which issues we need to repeat next year because they've driven such high engagement because of the nature of the problem.
That leads us to you, Catherine. Which are those issues that are most valued by the members that you're hearing from? It sounds like you're getting lots of great feedback. What are you hearing? How they're responding to the data?
The intensive care unit benchmarking and the future trend report definitely was one of the ones that generate a lot of questions from our members. The ED, my gosh, the questions just keep coming up. And virtual visits, that's another one that is high in demand. Lots of questions about outpatients because it is such a big topic, and yet we were able to hone into some of the data elements and showing our members how can they use their own data and customize it. Outpatient has been topics that got a lot of questions and high in demand. And to your point, Jayme, what are we going to do next? We continue to have new data coming in. So we figure that our members are very interested in getting refreshed data. Some of the things that we're going to do next year is to do some refresh as well. But the audience, listeners, if there are any topics that you're particularly interested, please give us a call. We'd love to hear from you.
At the beginning, we talked about why we pulled this data series together, combining different data assets. Some of our listeners may say, I want to be able to do that myself. What is your advice for how they should get started in identifying some of these types of insights for themselves?
First thing that I would point to is that all of these reports are actually similar to our podcast, publicly available within the Vizient Insights page. And a great place to get started is to read the issues, understand what kinds of data we are triangulating to be able to answer the questions, and then assess, do you have that data? Because many of you, I'm sure, do, internally available. We at Sg2 Vizient are always willing and ready to help our clients and members, understanding what types of data are we bringing to bear to solve each of these problems, address each of these challenges is the first step. And then trying to go through, okay, where do I have that data available? How do I bring it together myself to triangulate would be the best next step.
Just read through our reports. Some of the topics are perceived to be more difficult strategic decisions. For example, service distribution. It's usually when you're using data, can target the data and analytics can actually facilitate some buy-in and bringing the objectivities into the decision-making process. First thing is to understand the topics that you want to tackle and then set up a set of clear questions. The 10 reports only give you the tip of the iceberg, but then there are so much more that we can uncover with you and for you. What are some of those questions that you want to answer? And then one step at a time, we can help address those questions for you.
One of the surprising insights that we found was it was actually the EDs with the second lowest number of annual visits. So I think it was 25,000 to 40,000 maybe that had the longest length of stay. What I really appreciate about our approach in these reports is that it's a starting point and it leads you to the further questions that you probably need to be asking from a performance improvement standpoint to uncover further where you need to target specifically. We started talking to all of our colleagues, both internally, our physicians, as well as our strategy and advisory teams, to try to better understand this is an interesting trend. What do you think could be driving it based on your interactions with members and clients, our interactions as well? Why is the length of stay so much longer in a smaller ED, but not necessarily the smallest ED? Those conversations and that dialogue is incredibly important, but you have to know, what are you trying to solve for? What's the problem that you're trying to address? Is it truly capacity? Is it something else? What is that North Star that you want to work toward? Because that'll provide some direction. Otherwise, you get lost in analysis paralysis, our favorite over-analyzation.
If I could summarize, the first step is to understand the questions you're asking and use those questions to diagnose the challenge that you can solve. Because you don't want to get to a challenge that you have no solutions for or can't get to solutions for, but you want to get to a solvable challenge with enough granularity that you can actually make an impact on it. And you talked about the strategic decision making being more insightful. So then the next phase is the strategic decision making and being able to, using the collection of different data pieces, speak to the perspective of all your key leader stakeholders.
Absolutely. And what we're finding is that there are more leaders around the table to solve strategic issues or what present as strategic issues, to be able to anticipate and work ahead of questions that are going to arise by having a very clear understanding of the problem and all of the aspects of the complexity of the problem makes perfect sense.
In 2025, we are committed to another set of 10 reports. So please keep coming to our website and read our reports and give us feedback and give us suggestions in terms of some other topics that you want to see.
Thank you, Brianna and Catherine, for your insights today. And I appreciate you spending some time with me here today. I really appreciate our SG2 Perspective listeners as well. Thank you for joining us and look forward to seeing you on the next episode.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.